Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Time of the impulse. The time of the impulse arrival at different regions of the heart. At different regions of the heart. So this includes first is the SA node. So in case of SA node, the time in seconds is going to be 0. Next comes the AV node. So what happens in the AV node? AV node, the time is 0.03. 0.03 is from the SA node to the AV node. It is from SA node to the AV node. Next what we have is the bundle of His. So in bundle of His, the timing is 0.12. 0.12 is the seconds. So 0.12 is the case of bundle of His. Here 0.12, there is a AV nodal conduction time or AV nodal delay. So there will be a AV nodal conduction time or AV nodal delay. Then comes the ventricular septum. So here in ventricular system, the time in seconds is going to be 0.16. So this is the VS, that is the ventricular septum, 0.16. Here is the conduction time through the BH. BH means the bundle of His. Then looking at the endocardium. The endocardium means that it is about, the time is 0.17 to the 0.19. So it's the starting of the ventricular depolarization. So it is start of the VD, that is the ventricular depolarization. Then comes the epicardium. The epicardium is increasing. So ventricular septum, then comes the endocardium, and then the epicardium. So all these see a significant increase. So bundle of His was 0.12, then ventricular septum is 0.16, endocardium being 0.17 to 19, then epicardium. So epicardium, what happens? Epicardium is 0.21 to 0.22, and this will be complete depolarization of the heart. So there is a complete depolarization, and this is nothing but of the heart. To learn and grow daily like this, please do subscribe.